Hey everyone, thanks for joining in tonight. I'm Dr. Sally with Regenexx Pittsburgh. I'm going to be leading the webinar tonight. I'm just going to give people a couple more minutes to sign on here, and then in just a couple minutes here, we'll be getting ready to go. Thank you for the ones that are here, and I hope you enjoy the talk tonight. We'll be right back. All right, everyone, welcome. Uh, Thanks for joining us tonight. I'm Dr. Sally with Regenexx Pittsburgh. I'm going to be the one leading you guys in our live webinar tonight. So thanks for signing in, and let's get started. So first things first, let me introduce myself. I'm Dr. Jess Sally. I have been with Regenexx now since 2015. I did my undergraduate work at Virginia Tech and the Virginia College of Osteopathic Medicine. I am a Pittsburgh native. I grew up in Fayette County, so I am from around the area. And I came back home and did my residency and fellowship at the University of Pittsburgh in physical medicine and rehabilitation, and then subspecialized in musculoskeletal sports and spine medicine, and just passed my sport board recertification again this year. So that's wonderful. And then, like I said, I've been a member of the Regenexx community affiliate since 2015. So let's talk about why you're here. So you're joining us tonight because you're looking for answers to questions about what we can do to help you with things like pain, whether that's arthritic pain or tendon pain or spine pain or whatever it may be. Looking for alternatives to help you to avoid surgery. Looking for alternatives if you're not necessarily a surgical candidate. And then looking for things that are going to help with reducing downtime from pain, different types of options that won't allow you to have to rely on medications, or you're just not ready to slow down and you want more out of your life. So let's talk about what our options are. So tonight we're going to go over what Regenexx actually is and some current options that are available for treatments and for interventional orthopedics in general. We're going to talk about what makes Regenexx different from other things that you're going to see out there. We'll reference who this is for, and we'll talk just a little bit about some of the results. So Regenexx is a way to help you see an alternative choice in your care. We're also going to help you discover if you're a candidate for the treatments that we offer. And then we're going to help so that you can schedule an expert evaluation with one of our physicians and get all your questions answered about whether or not we think we can help for your specific purposes. So right now, what we notice is there's a gap in the continuum of care that usually leads to surgery, and we want to insert ourselves as a solution to that gap. So basically right now, what you typically see is people will go through treatment with pharmaceutical options. They'll have steroid injections. Maybe they'll do some bracing or some other alternative treatments. They may see a chiropractor. They may go to a physical therapist. And then if all that doesn't work, typically the response is, well, you got to go and have surgery. Regenexx, as a community and as a treatment offering, want to insert ourselves in between that so that we can help you to avoid surgery and find a better solution to the issues. So the big question is, do these surgeries actually work? And what % of these surgeries are actually needed? So you can see there are a lot of different surgeries that are performed throughout the year in each one of these different areas. So there's a huge amount of people that undergo surgery for various reasons. But with those surgeries, there are risks. And obviously on the left there, you can see that surgery increases your risk of very bad things by about 300%. So all the things that you don't want to see are greatly increased once you start being really invasive with different parts of the body. About 40% or about 47% of these different types of surgeries are currently covered on your health plan, but is it necessarily better for you? So instead of big major surgeries that are actually cutting things out, we want to instead try to use biologic agents that come from your own body to help reduce pain and improve function. So that brings us to interventional orthopedics. And basically that's the transition from the knife to the needle. So really what we're doing is we're using your own cells that you produce within your own body to redirect those processes to help reduce pain and improve function. So those cells come from your own platelets in the blood, and they come from your own bone marrow concentrate inside the bone. Interventional orthopedics can help to reduce your need for elective surgeries by up to about 70 to 80%. And really, when I describe this to people, usually I'm comparing it to interventional cardiology. Before, when you had a heart problem, they had to cut into your chest. They had to do a big open surgery and do everything that they could to get to the heart. Now, a lot of those procedures are done by snaking a little camera up through the vein and doing procedures very interventionally that don't require a lot of open heart processes that are really dangerous. So that's the same way with orthopedics. Now we're transitioning to using needles and very small needle pokes rather than doing big open surgeries and removing different parts and replacing them with metal. So Regenexx, like I said, is part of the interventional orthopedics community. So Regenexx is a certain grouping of treatments that falls under the interventional orthopedics option. So interventional orthopedics, like I said, less invasive, new medical specialty. We're using orthobiologics that are delivered by injection, and it's a lower risk alternative to bigger, more invasive surgeries. Regenexx within that community is a very highly selective physician network that practices these procedures very specifically. Uh, Regenexx has the best treatment protocols in order to achieve the best results for you. And those protocols were because we are a world leader in research and development. So we've used that research to feed back into the protocols and provide the best treatments that we can. It's also a national self-funded employer practice. So we all are individual physician owners of our own practice, but we all work together as an affiliate network to help build these procedures to be the best they can be for our patients. Common conditions treated are the same things that you would see from your typical neighborhood orthopedic office. So everything dealing basically from the top of the head to the base of the toes, shoulders, knees, wrists, elbows, hips, ankles, feet, spine, we do it all. So if there's pain that's affecting your body from a musculoskeletal standpoint or spine standpoint, we probably have an option that would be good for helping with treatment for you. This is kind of a typical setup of one of our treatment rooms. You can see the big machine here that is shaped like a C near the window. That's called a fluoroscope. That's an X-ray machine that helps with needle-guided treatments, mostly in the spine. The machine directly to the right of that is something called an ultrasound machine, which we can use to very precisely guide needles into joints, into ligaments and tendons, and into areas that require some highly skilled ability to put that needle there. This is our Flex laboratory, which is a fully functioning ISO hood lab, where we take the blood product that we draw from your blood or the marrow samples that we get from the bone marrow, and we process all of that by hand in the lab right here, right there in the clinic. And that allows us to achieve very highly specific concentrations and very high numbers of cells to be able to give you the best treatment outcomes possible. Regenexx, obviously you can see here, this individual had injections performed, and really the only thing that they have to show for it is two little Band-Aids. There's no big blood, there's no big incisions, there's no sutures. So these procedures obviously result in less downtime, shorter rehab recovery, less need for drugs. You're back to work in a few days, not a few weeks, and you're awake through these procedures. So we don't need a lot of anesthesia that you have to recover from, where they can create worse side effects. So we'll go over a couple examples of interventional orthopedics that we use in the clinic. Right now, we're doing things like, and this kind of speaks to the specificity of these procedures, we're doing injections into the ACL for torn ACLs that we see either in anybody that's had injuries or high-level athletes. And we do these under X-ray guidance to be able to see the flow of the contrast into the ligament. These are very highly specific procedures that we're using now to replace the need for surgery where people normally would have to have surgical repair of ACLs. This is an example of injecting into a shoulder, specifically into the labrum of a shoulder. So basically just showing how we use, this is an X-ray image, how we're using X-ray guidance to very precisely guide these needles to make these procedures as effective as possible for you. This is an example of a knee treatment where we're using X-ray guidance to actually inject cells into the bone and into the joint. The reason, and this is for a kneecap arthritis, we're doing this because we're actually finding that lesions like this within the bone are creating more pain for people. And these types of treatments are actually helping to reduce pain in the bone and in the joint to help again with creating the best possible outcomes. This is a video of a very precise needle placement around the median nerve in the carpal tunnel. So you can see this is the size of a normal pea. This is the size of your nerve. And this needle is a very fine needle that we're directing sort of right around that nerve area and placing those cells directly around that nerve to reduce stress from carpal tunnel disorder. So as you can see, we can use very highly precise needle placements, again, to give you good treatment outcomes and reduce pain. So how does regenerative medicine work? So what is PRP? PRP is platelet-rich plasma. PRP comes from your blood. It is where we draw blood from your arm, just like you would at the PCP office, and we spin that down and we take the platelets out of the blood. The platelets have growth factors that help to amplify healing, and you can think of them almost like an espresso shot for local repair cells. So they just kind of hype up that healing response that normally happens within the body and helps those cells that actually fix tissue to work harder and longer. Stem cells are a separate type of cell. Those are actually found in the bone marrow, and the stem cells are actually the cells that are doing the repair work. So they're the general contractors for the repair job. They tell other cells what to do, and they tell cells how to repair specific damage. They utilize those platelets to help with using those growth factors to help with that process. And your cells turn into the brick and mortar that actually helps with building tissue and replacing the cells that are needed where other things are damaged. So we use probably PRP a little more often than we perform stem cells. We do use PRP with the stem cells, but everybody's different treatments are based on the evaluation and the exam that we perform in the office. So we never really know what we're going to be utilizing for people until we get you in there and see what we're dealing with. There is a cost difference between the two, but not everybody needs stem cells. So we kind of take that on a case-by-case basis. Which one is for you? PRP tends to focus more on smaller joints or less severe arthritis. It also works well for ligament damage, tendonitis or tendon tears, and also in the spine. Bone marrow concentrate or stem cells work better for larger joints where there's more area that needs treated, more damage, so more severe arthritis or higher severity arthritis. And also when we're doing injections for treatments into bone where there's pain in the bones or arthritis that's transmitted pain into the bones. So what can you expect during a typical stem cell treatment? So there's actually 3 different days that you'll be coming into the clinic for the full stem cell treatment. The first day is where we actually do a pre-injection or a primer injection. The analogy that we use is we're tilling the soil before we plant a garden. And what this injection does is it helps to stimulate the joint. It helps to stimulate the cells inside the joint to be able to accept those stem cells when they get introduced. And it also stimulates your body's own immune response to the area to help with healing. We also inject that mixture into a lot of the tendons and ligaments and structures around the joint to help with stabilizing that joint more effectively in order to optimize the outcome. The second day, so after that first day, a couple days are going to go by. The second day is going to be the stem cell harvest and then the re-injection later on that day. So where do we get the stem cells from? We get the stem cells from an area on the back side of the pelvic bone called the iliac crest. There's nothing that sits over top of this bone area except fat tissue and butt muscle. So there's no major nerves, there's no major arteries. We place that cannula into the bone, and this is where we draw out the stem cells for the treatment. Like I said, most patients don't have too much discomfort with that part of the procedure. It's a pretty low discomfort on the pain scale. We also allow people to use a little bit of nitrous oxide that you administer to yourself, laughing gas, to be able to help with blocking down a lot of that pain response and helping to make that more comfortable. So the stem cells are then re-injected later that day after we take those cells out and we process them in the lab. So this is where we're planting the seeds in the garden. So the injections are done to the areas of damage or pain. We utilize imaging guidance to help with identifying those areas and getting those cells to where they need to be effectively. We're using only cells that are sourced from the patient, so we're not using any third-party products and we're not sending cells outside of the office for additional processing. Um, like I said, we use precise guidance to get those cells where they need, and everything occurs on the same day. All right, after that process, a couple days are going to go by again. Day 3 is where we fertilize that garden that we've now planted. So we take another blood sample from your arm, just like another blood draw from your PCP's office, take those cells, take the platelets out of those cells, and inject that into the area or into the joint where the stem cells are working, again, to try to act like miracle grow for those stem cells and keep that reaction working stronger and harder. These are the espresso shots that keep things activating quickly. The lab processing on this day only takes about an hour. I know it says 1.5 to 2 hours, but it's a little faster than that usually. And we can usually get you in and out pretty quick. So a little bit of the history of Regenexx as a practice. Regenexx was the first group in the country to be utilizing stem cells for the treatment of musculoskeletal issues. We've done the most patients. We have the largest registry of patients that we've treated anywhere in the world, so that we can evaluate how these patients have done from the beginning of their treatments to the end of their treatments, and that gives us the largest volume of non-biased data to really know how these treatments work and how the outcomes of these treatments affect people. It's very safe. We have the world's largest safety paper published on this issue. It includes over 2,000 patients looking at negative outcomes and patient complaints. And really the biggest, most overwhelming negative thing that came from the study was just pain and discomfort at the injection sites. Otherwise, it's an incredibly safe and minimally invasive procedure. And like I said, it's the most researched. So Regenexx helps with producing probably over 50% of the world's research in orthobiologics. And again, that research is used to help feed back into these procedures so that we can make them the best possible procedures that we can for our patients. Like I said, we have the world's largest safety paper showing the safety of these procedures and therapies for orthopedic conditions. We've looked at how these treatments actually affect people and how they affect people in the long term. And like I said, the biggest complaint has been just pain at the injection site. As I said, with the research, we have the largest registry that follows. I think it's a lot larger than 34,000 at this point. So, that number continues to climb every day when we're having people fill out the paperwork for the registry. And again, it doesn't bias data after the people have had treatments. It's from the time they walk into the door to have treatment at time 0 until, a year after they've had the treatment and follow up. So we're actually seeing how patients are responding to these things and what those real numbers look like. And again, using these treatments to feed back into using these numbers to feed back into other research and continuing the quest to make sure that we're stacking the deck in your favor. So, you want the best doctors, you want the best imaging protocols and doing these procedures very safely. You want the most research that helps to improve the outcomes of the treatment and also helps to give us better ideas of how these treatments affect people long term. It allows us to make these treatments very personalized for you. So it's very tailored to what your specific issues are and how we would want to treat that. The evaluation and the candidacy all comes into how we feel we can best formulate a procedure that's going to give you the best outcomes. And we're always upfront with our transparency about whether we feel like you're a good candidate to have these procedures done and what financially that would look like. So again, this is for people who want to avoid surgery. This is for people that want to keep all their parts and don't want to have a lot of lengthy downtime or rehabilitation. You don't want medications, or you want to get off of certain medications. If you've had and failed surgery before and you want to try to avoid that again, or if you're too young for surgery, we have had some patients in their younger years who have been told that they are on a road to a more invasive procedure, and we have done our what we can to keep them away from surgery, and it's worked out well. Results, like I said, the best practices are going to give you the best outcomes. So we again put a lot of time into establishing protocols that best deliver these treatments, into utilizing the best protocols for rehab and for monitoring patients after these procedures to make sure that the outcomes that we get are going to be the best for your situation. Everything that we do is with minimally invasiveness, so there's less pain, and that helps with increasing function and recovering faster. Improved mood when you feel better. When you feel better, you do better. So people have been off of pain medication and back to the preferred and active lifestyle that they want to pursue. So, people love to say, well, I'm going to hold off. I'm going to put it off. I'm going to, maybe next year, or I don't have time for it right now. But you're avoiding that inevitability that you're continuing to put that on the backlog, and your condition is continuing to worsen, and things are continuing to sort of go off the rails. So, the sooner we can get ahead of this, and the sooner I can get you into the clinic and we can talk about what we can do, the better, the faster that's going to put you back on track for getting back to what you want to do, whether that's fitness or weight loss, or just really, playing with grandkids, or just doing some gardening, or whatever it is that you're into. We want to increase your quality time with loved ones. We want to get you back to doing what you want to do. And really, nobody's getting any younger. So there's no, every day is another day that goes by that you don't have this, that you don't feel better. So we want to try to stand in front of it and get you better faster. Financial information, what insurance does cover when you come to us. It covers consultations. It covers follow-ups. It covers any diagnostic needs that we might need, whether that's, additional x-rays or imaging. There's also, bracing and some physical therapy that's all covered. The only thing that insurance does not cover is the actual procedures themselves. And there is a wide variety of pricing that happens with this type of thing, and it does depend on what we're treating and how we're treating it. So, it's not, I'm not going to be able to break that down until I actually get you in the clinic and I can review it a little bit more closely, or any of us can review it. But what I will tell you is that very commonly, with the amount of copays that somebody has, or with the deductibles that you may be responsible for, or the amount of copays that you'll end up spending on rehabilitation after surgery, you may end up paying more for the traditional orthopedic surgery than you will for some of these other procedures. So just keep that in mind, and there's also time off of work that you'll need to be responsible for financially. So we're really trying to, not burden you with a lot of downtime and additional rehab that are going to end up probably being more costly for you in the long run. So the next steps for you are to really get into the office and see us. You usually don't need a referral, so just give us a call, and we can probably get you on the schedule pretty quickly. Bring imaging if you have it. If you have MRIs or if you have X-rays, go ahead and get those together. Call our liaison. I'll give you guys the number here in just a little bit. Go to your appointment. We can do it in the office, or if you're coming from really far away. I know I have some Canadian patients and some New York patients and some people from out of state sometimes, so we can do some video appointments to try to get in front of you. We'll get some additional imaging if you didn't have it before the visit, or we'll get some new stuff if we feel like we need to. We'll decide if you're a candidate and what treatment we need to do. You'll get the treatment done. You'll go get some rehab, and you'll get back to your function. So first things that you'll need to do is just schedule a new patient exam. Here is the contact information for our national call center liaison, Sarah. You can call our office at 412-963-6480 and just select that option, and she will be happy to talk with you and get all of your information so that we can start the process. So what I'm going to do now is I'm going to open it up to questions. Um, so I'll pop back here on the video. And if you guys have any questions, just go ahead and write them in the Q&A section, and I'll be happy to field anything that you guys um, have any burning questions for. I'll give you a few minutes to write some things in there, and then I'll just answer them as I go through here. Um, I am glad that you guys came out for the talk tonight. I hope that it was a good experience for you. Um, and I hope you guys were able to learn something. I'm not seeing any questions pop up here, oh wait, maybe I got one here too. Oh, here we go. All right. Can you do bone marrow or stem cell treatments on both knees at the same time? Typically, no. Um, the larger joints that require more attention, if they're severely arthritic, we usually do stem cell treatments on single large joints. But for the joint that maybe the secondary joint that maybe is not as bad as the primary joint, typically I am doing some additional treatment with platelets for that opposite joint, and people are doing very, very well with that. Next question, is there a difference between using a needle versus a knife in invasive interventions? Yeah, I mean, with a needle, you're making a poke hole in the skin that is almost microscopic. With a knife, you're actually using a very large cut, and you're opening that skin all the way down to the bone. Opening that much area definitely increases your risk for infection. It increases your risk for bleeding. It increases risk for nerve damage. It increases your risk for all sorts of different problems to happen. So yes, there are vast differences between using a minimally invasive needle and using a larger knife. Uh, Next question, does this help cervical instability? If so, how often? Yes, it helps a lot with cervical instability. We do treatments for that very commonly. So again, everybody's a little bit different in terms of how they present. So it's worth coming into the office, having the evaluation, talking it through with us, and yeah, we treat that very commonly, and people very commonly do significantly better. Next question, for degenerative arthritis, does treatment have to be repeated? Uh, you know, Usually it depends on what kind of treatment we're talking about. For the stem cell treatments, there's research now that shows that even in end stage arthritis, like even severe arthritis, bone on bone arthritis, the treatments are effectively helping people to avoid surgery in 87% of cases for 15 years. So the time frame is extensive. And beyond that, we don't know, because there's just never been studies that have looked at that timeline. But typically, these procedures are not needing to be repeated. And there are some people that do have some additional treatments that maybe happen over years and years, but it's not like this is something that needs to happen year after year for people. Next question, if I'm 71, how will that affect the outcome for the knee? Uh, age is not a factor in these treatments. So regardless of how old you are, you can have these treatments done. And we've even treated people into their 80s and even up into their 90s. The oldest person that we've treated is 98. And they all have had good outcomes. And the way that we actually draw these cells and process the cells, it guarantees that we're going to have enough cells for treatment even, into older years. But as we age, our stem cells are still good. There's no such thing as you're too old, your stem cells are too old or anything like that. So that's a myth. If that were the case, you wouldn't heal when you cut yourself. So, our stem cells are constantly working, they're constantly regenerating tissue, they're constantly doing things. So yes, even at 71, you can have very, very good outcomes with these procedures. In fact, 71 is probably the average age that we treat. Next question, can a ligament heal where it scars over a nerve? That's a very specific question. I think that it would take us looking at some ultrasound images or looking at this in the clinic to actually see if there's treatment options that are available. So that's a very specific question that I think we can answer in person with some ultrasound diagnosis. Next question, where are your clinics located? Our main clinic is in Fox Chapel, which is just a northern suburb of the Pittsburgh area. And we have another clinic in the South Hills of Pittsburgh in McMurray, but the main office where we do all of the treatments is the Fox Chapel office. But I can see people in the South office as well. Next question, I sustained a rotator cuff injury, supraspinatus totally torn with 1-inch retraction. Very specific stuff. Do I need surgery from Canada? I I would say that this is probably something that we should talk about in person. I it's hard for me to tell without looking at the injury. I mean, I know everybody wants to have their own personal consult sort of on these chats, but again, it's good for me to be able to talk to you and kind of figure out what the specific issues are and what we need to do or what we have the option of doing. Next question, explain the rehab process. I'm not a physical therapist. Usually what I would do is I will write, we have physical therapy protocols that we give to people after the treatment, and we send people to physical therapy, and you can do that at any physical therapy location that's close to you personally. So you don't have to come to our office for rehab. You don't have to, there's no there's not like a specific rehab thing that we do, but there are some physical therapists that I have throughout the southwestern PA area that I know are familiar with our treatments, so we can always talk about that afterwards. And usually it's a couple times a week of rehab, maybe for anywhere from 4 to 6 weeks. That's usually the most that people will need. So it just depends person to person. Next question, do stem cells fill in any gaps in total cartilage loss on top of the hip? Will it create fibrous tissue? So stem cells don't actually create new cartilage. They help with protecting subcortical bone that is exposed to that bone-on-bone contact. So it does almost act like a clear coat protectant over that bone. So it does help with reducing pain and improving mobility that way, but it does not actually reformat cartilage where there's severe areas of cartilage loss. That does not happen in regenerative medicine. So if anybody's telling you that they're regrowing cartilage, that's false. But there are ways that those cells protect that bone and protect the pain process. Question is, can I have Regenexx after a knee replacement? The answer to that is yes. And I will say that with the caveat of most of the time, I would say 99% of the time when people are still having pain after a knee replacement, it is usually not coming from the hardware. It's usually issues with tendons or other problems around that joint that are giving people problems. And I've run into that issue a lot with patients. And I will say that a lot of the time I've treated patients after surgeries and they do very, very well. Next question, not to put you on the spot, but what can I expect the cost to be for my knees? Again, that's an impossible question for me to answer because it really depends on what we're treating and how we're treating it. So that is kind of a very wide range. So, if you came into the clinic and we were able to evaluate you, we were able to go over a treatment plan, we would definitely be able to give you what that would look like. But it does matter how we're going to do it and what we're going to do. So, if you want to come in and talk with us, call the office, and we're happy to do an evaluation and give that data to you. No problem. Um, Next question, knee replacement will last 20 years plus. How long does this process last? I just answered that a little bit ago. Depending on the process that we use, there's research now that shows that the treatments are good, or that providing good relief for up to 15 years. That's just as long as the treatment has been studied. So we don't know beyond that. But again, much less invasive than a knee replacement. And after 20 years, if you need a knee replacement again, that's another big procedure to have maybe later on in life. This is something that is very easy to do. It's very, like I said, minimally invasive and very, then there's extremely low risk. So, it's not like having to go through a whole nother surgery again. Um, Next question, had L4 and 5 fused, still have sciatic pain. Yes, PRP can help in these situations. Again, it depends on where some of that pain source is coming from, but I've treated plenty of people who have had spinal surgeries in the past, and we treat them very effectively with PRP around the areas that are still bothersome. So certainly is something that's worth coming in and for us to take a look at. If treating cervical instability, does hypermobility lessen odds of success? Again, this is something to just have us address in the office, so that we can kind of see what we have going on with the upper neck, and how we would want to go about treatment for it. Next question, how long do you need to be off work after a stem cell hip procedure? It depends on what we do for the hip, because certain parts of the hip, and the hip is the only one where we do some weight bearing restrictions depending on how we approach the hip. So there may be a little bit of time where you have to lessen the load bearing on that leg. But it's yeah, I think the most that we do with that is 2 weeks, and that's kind of a progressive a weight bearing return. So that is the only one, though. For things like knees or shoulders or spine or anything like that, there's no weight bearing restrictions, and people are usually back to work within a couple days after the procedure. So again, just something that we would have to address in the office depending on what we're going to do. Does the age of injury indicate your likelihood of success? No, although it does depend on what we're dealing with. But if you've had arthritic pain for years, or if you've had things that have been going on for a long time, that does not preclude you from having the procedures, and people still do have high success, even with having arthritic pain that's gone on for a long time. So if you, again, that goes back to that, stop putting it off, come in and talk to us, and there's a good chance that we can help you out. Um, with how to treat hip synovial osteochondromatosis. Again, very specific questions. We'd have to have you come into the office and see what we have going on with that. I mean, it's not, there's not like a straightforward answer to all these different very specific pathologies. Can you rehab yourself if you have the pro call after? So I usually tell people, if we're talking about rehabilitation, I know there are people that say, well, I exercise, I'm active, I do a lot of things around the house. Um, I will tell you this, it's a lot different and it's a lot better when you have somebody who's trained in evaluating these things and watching your mechanics go over it with you and really focus on the problematic areas, because I'm 90% of the time people are usually missing the main thing that is causing some weakness and contributing to some additional pain. So I really, really, really promote going and seeing a physical therapist and working through some of the rehab after the procedures. I think it makes huge differences in the outcomes. It's just like putting a new tire on a car, and then you say, well, I'm not going to balance and line it, or I'm going to do it myself. I'm not going to rely on the machine. But if you don't do that correctly, you're really wearing the problem down in the same way that you had it. And that can be detrimental for, things that are down the road. So I always am a big promoter of physical therapy and having somebody guide you through that process after the procedure. And that usually works really well. Um, Next question, is the stem cell procedure the same as microfracture procedure on the top of a hip? No, it's extremely different. Again, the microfracture procedure is a surgery. It's minimally invasive, so to speak, but it's still a surgery. And this is different. We're just using injections. We're not actually going in there and causing any trauma to the actual hip or to the cartilage. Um, no, thank you. Thank you for being here. Had a person thank me for my time. So, and the last question, would I have to wait a certain period of time if I was recently treated with Synvisc? No. Actually, no. With knees or with whatever joints are treated with Synvisc, we don't have to wait. With steroids, steroid injections that are recent, we do have to wait 6 weeks after those types of injections. Now, you don't have to wait to come in and get an evaluation, but we would have to just wait a certain period of time. But for Synvisc, there's no time window that we have to put off treatment for that. So yeah, the sooner you can get in with us, the sooner we can get you started. These are all good questions. Last one more question. For age of injury, if not related to arthritis but ligament damage, does length of time matter? Ligament damage, yeah, I know. I mean, people have ligament instability that goes on for years, and we treat that very effectively. So, no, the length of time isn't usually a factor with that. But again, worth us seeing in the clinic just so we can make a better assessment of what's going on that way. These are great questions, guys. You guys really are asking a lot of good stuff. So I appreciate you doing that. Um, if there are any more questions, I'll leave it open for a few more if anybody has any. Oh, and then no, you're welcome. So thank you guys again for being here. Thank you for participating in the talk and listening. I do hope that it was really informative for you guys. Like I said, I'm Dr. Sally. So give us a call in the office. I'll give you the number again. It's 412-963-6480. Give us a call, schedule an appointment, and come and see us. I think we can do a lot of good for a lot of you guys. So thanks for being here again. Have a good night. Have a good rest of the week, and God bless.